what to expect for your total joint outpatient surgery.
Today in orthopedics, we've learned more and more that we've realized more and more that patients' expectations don't match the surgeons. So I tell all my patients, your expectations need to match mine, not your 10 other friends that have had knee or hip replacements. Because I see it all the time. Every patient experience is different. It's even different if you're this patient and have the one knee done and the other knee done. So what do I expect? I expect to get rid of 90+% of your pain. I expect it could improve for up to 2 years. The thing you have most control over is your commitment to preparing yourself and committing to doing your exercises. If you commit to doing your exercises preoperatively and postoperatively, you can shorten that span down. So I tell most of my patients by 3 months, you'll be 80% better than you were before your surgery.
How is outpatient surgery different?
The biggest difference between having your surgery done as an outpatient compared to the hospital is it's all about your personal experience. The patients really feel like there's a great team there to make sure they're successful. And it's the nurse ratio to patients and even the physical therapy ratio to patient is so much better than it is in an inpatient experience. The thing that I'm most proud of as a founding member of Orthopedic One and Ohio Orthopedic Surgery Institute is that we really provide intimate care. The staff has worked well. We've hired people that really value this, and that is one of our main values as well. The other big difference is the patients are up and moving faster. They're discharged to home, getting to the place that they love to be faster. And actually, there's been some studies that show that there's less complications. So that's kind of our focus on trying to get you up and more and mobile. So it's not unusual for patients to go home 5 to 6 hours after their surgery.
When should I have a knee or hip replacement?
The time you should have a hip or knee replacement is when you yourself as a patient feel like it's affecting the quality of your life. Again, we look at you as an individual and we want you to know you're the one that decides better than I. I get asked all the time, Dr. Mcshane, what would you do? Well, I'm not the one living with the pain, so it's hard for me to tell you what I would do. So I'm going to bounce the ball right back to you and ask you, how is this affecting the quality of your life? And everyone's different. Some people just want to sit on a couch. Other people want to exercise. They want to partake in hiking, biking, swimming, things of that sort.
How long does a knee or hip replacement last?
A common question I hear is how long does hip or knee replacement last? I tell patients if you take good care of it, meaning you avoid high impact, don't run, jump, pound, twist on it, it will hopefully last you 20, 25 years. It is rare when hip or knee replacements fail. Probably one of the most common reasons is infection or they come loose.
Am I too old?
I don't feel anyone is too old. If I have some patients that are 90+ years of age, they only have high blood pressure. They still have fire in their belly and they still want to live. They want to be independent. And they also, more importantly, they don't want to have as much pain.
Is it safe?
The most important thing about safety for the patient is that we pick the right patient. You have to fulfill certain criteria. You have to be healthy, BMI less than 40. You can't have a lot of heart conditions or previous strokes. So it's all about picking the right patient. The thing that I see over and over again doing this for many years is that the patients that come in that are prepared emotionally for their surgery are the ones that do the best. They have a lot of confidence in their ability to participate in therapy. They make a big commitment at going to the class, reading the booklet, learning as much as they can about what's going to happen to them before, and then partake and really make a hard commitment to post-op physical therapy as well.
What does pre-surgery involve?
So the thing that I feel very strongly about is preparation. The more prepared you are on several levels, the better you do. And I see it all the time. Patients that make the commitment to prepare, along with their families or their caregiver, is the key to success.
Why is pre-op preparation so important?
The key thing about pre-op preparation is physical therapy. I actually published an article that showed that people that do exercises before are the ones that are most successful at doing steps, walking with their walker, progressing to their cane, and getting back to work quicker. So the take home here is you're going to do steps the day of surgery. The ones that really are successful at doing steps are the ones that do their pre-op preparation with the physical therapist.
What is pre-admission testing? Do I need it?
The purpose of pre-admission testing is we want to make sure you're healthy, and that's what your family doctor, he'll check your heart, he or she will check your heart, your lungs, your kidneys, and they're just going to make sure you're a healthy candidate. So that way we can assure that you'll have a great outcome and a good experience.
What medications do I need to stop taking before surgery?
We don't want you to have excessive bleeding. Keep in mind, it's very rare. In fact, I can't even remember the last time we had to do a blood transfusion. But what we're really trying to do is have you stop medicines that affect bleeding, such as anti-inflammatories, aspirin, Plavix, Coumadin, Xarelto, Eliquis, things of that sort.
What's it like the day of surgery?
The day of surgery, there's a lot of anxiety. Not only you as the patient, but also your caregivers. Our number one focus that day of surgery is to help make this as a relaxed experience as possible. So if you do have a lot of anxiety, tell us so we can address it and help you. We do have some great relaxing medications that will help you get through the crucial part. I can remember personally when I had surgery once, I felt so comfortable and confident the anesthesiologist was out after my best interest. And boy, he gave me a little medicine and it was wonderful. And all of a sudden I woke up in the recovery room and said, wow, is it over? Couldn't believe it. But that's the kind of experience we want you to have.
How do you control potential pain pre-op and during the operation?
In the pre-op holding area, the morning of surgery, we will give you a list of about 3 or 4 medicines. Number one, it's going to be an anti-inflammatory, which will help take some of the swelling and inflammation away. Next, we'll give you Tylenol, which we know helps as well. And some patients feel it doesn't, but keep in mind, this is a layered multimodal approach. What works for you may not work well for the others. So we kind of know from experience by giving you this regimen of medicines, it's a good jump on your post-op pain control. In addition, big common side effect of narcotics is nausea, vomiting. So we give you about 2 or 3 different medicines preoperatively in a proactive way to prevent that nausea and vomiting from the narcotic that we're going to give you during the surgery and after. Now let's break it down to intraoperatively. The key thing that I do at the time of surgery is we do these little blocks. Actually in pre-op you'll have a block, but also intra-op during the surgery I'll do an additional block. And this is like going to the dentist, it's numbing medicine. We actually have a new numbing medicine that lasts up to 72 hours. We hear it all the time now since we've been using this medicine. Patients hardly have any pain for the first 24 to maybe up to 72 hours.
What's my pain like post-surgery?
We're all very familiar with how narcotics have been abused around the United States, particularly the state of Ohio. We're number 2 in the country for abuse. So my focus is, number 1, I want you comfortable, but number 2, I don't want you to get addicted to narcotics. So how do we do that? Well, it's pretty simple. You take anti-inflammatory medication and/or Tylenol to help lessen the need for the narcotic.
How long is my surgery?
I have been doing this for 30 years, so the time of surgery for me as a surgeon is probably anywhere between 45 minutes to maybe an hour. Now, I want to qualify that a little bit. The thing you have to realize is in the operating room, because I only really do hip and knee replacement surgery, I have practiced this like riding a bike, and we are so methodical in the operating room. Everybody's focused, they're quiet, and they really want to make sure we do the best for you. And the way we do the best is we don't waste time in there. Now, what does this mean to you as a patient? Less blood loss, less time in the operating room, less infection rate, and believe it or not, because of those things, we get you up and moving a lot quicker, and you're back to work before you know it.
How big is my incision going to be?
The length is directly proportional to how big the patient is. If you have more adipose or fatty tissue, more muscle, we have to make it a little bigger. On the average, they're about 3 to 5 inches in length for hip and knee replacement surgery. The hip incision is over the side, the knee incision is usually right down the middle.
When will I be able to walk?
You'll be up walking within a couple hours after surgery. Again, every patient has a certain level of anesthesia, certain number of kind of blocks, and we're not sure how that's going to affect you until we've actually performed it. But our goal is to have you up walking within an hour or 2 after surgery.
How frequently will I take my pain medication?
The frequency in which you use pain medicine is different for every patient. The first 2 to 5 days, we encourage you to kind of stay ahead of things, because once you're behind, it's very hard to catch up. So the whole focus is we have really 3 different layers. Number 1 is the anti-inflammatory medicine, which doesn't have very many side effects. Number 2, we add in Tylenol. And then the backup, last one we like to use is the narcotic, such as oxycodone or Norco. The whole idea of pain control is you're in control. You're the one that's making the decision as a patient. How much pain can I tolerate? As we all know, we all have different thresholds for pain.
What support do I need at home post-surgery?
The help that you need at home following surgery, you're going to need somebody at home to support you emotionally and physically for at least, I'd say on the average of 5, maybe up to 7 days. What are the things you're going to have to do? Well, it kind of depends upon you as a patient. Number 1 is how motivated are you? If you're motivated, you may not need them as much as you thought, but you want to have them there just in case. Things they may need to do: get your ice out of the refrigerator, put on your knee or your hip, prepare meals, maybe help lift your leg the first day or 2 until the pain medicine wears off and the block wears off. Maybe have them run to the store and buy some more food or get your medications.
Will I need physical therapy at home?
Typically, you do not need home physical therapy when you have a hip replacement. Most of those patients focus on their own exercises that they've learned preoperatively, and within 5 to 7 days, they start outpatient physical therapy. Total knee patients, on the other hand, will commonly have a couple visits, but we encourage both hip and knee patients to try to start their outpatient therapy sooner instead of later, because we have learned over the last 30 years that patients that get to outpatient therapy actually recover better and quicker.
When can I drive?
It depends upon the patient, and it depends upon whether it's the right or left leg. And it also depends upon whether you have automatic or manual. And so let's just go through that a little bit. Number 1, if it's your right leg, it may be more like 4 to 6 weeks before you're back driving. If it's your left leg, more like 3 to 4 weeks before you're back driving.
When can I go back to work?
Return to work is really dependent upon the type of job you have. I let my patients tell me when they think they're ready. There's several things going on here. Not only are you healing physically, but emotionally you're healing too. The worst thing about if you go back too soon is it creates more stress, and that will delay your recovery. We don't want you to have a lot of stress. So you're going to have to kind of decide, when do you want to return to the stress of work? And for example, if it's a desk job, I have some people going back at 3 to 4 weeks. If it's a desk standing job, 4 to 8 weeks. If it's a labor job, more like 10 to 12 weeks. But we always let you kind of help me make the decision, because you know the demands of your work much better than I do.
We want you to remember communication is key to us.
The thing that I want you to understand is I'm the doctor that you hire, and I'm the one that's going to do your surgery. I don't hand it over to a fellow or a resident, it's me. I'll stay there and make sure your surgery is done well by me. The other thing I tell all my patients is I take my own phone calls. The thing that I feel is really important is that the thing that's going to make our relationship successful is good communication. The door is always open. I tell my patients all the time to call me. I hardly ever get phone calls. I think the reason being is I have such a great staff that communicates to you as well. And I think the other reason I don't get a lot of phone calls is we do a great job of preparing you for surgery. But I also am here to realize everyone's different. Everyone has a different set of questions, a different concern. So don't ever hesitate to call my staff or myself to clarify things. We're here to help you. We want you to have a great outcome.
Have additional questions? Please take a look at Dr. Mcshane's bio page at www.orthopedic1.com.